premium support is where you have money coming from somewhere, whether it's in your like when I was an employer in my practice, I provided so much of the premium, and the employee provided so much, and there was a copay. There's you let the markets decide that. What we did, and I did a poor job of describing this 8 years ago, when the debate was first going on about pre-existing conditions, and so we all agree on that. We probably all up here agree on rescission and lifetime limits. Those are not things we're going to debate actively on. I think everybody agrees on that, but this allows the free market system to actually work. Right now in my state, 70% of the counties have one provider. That's not competent. It did the opposite of what we thought it would be. Premiums in my state, Tennessee, which not a rich state, went up 62% this year on the exchanges. And in my hospital system at home, which is a large system, a medical school, a branch of St. Jude's Children's Hospital, I was on the clinical faculty of the medical school there. 60% of the uncollectible debt in that system plus are people with insurance. You didn't hear me wrong. With insurance, not without. So they don't have anything. If you make $35,000, $40,000 a year, and you have a $6,000 out of pocket, you don't have anything. And people are getting denied care because they can't afford the out of pocket. And providers like me in hospitals are having to eat that or provide the care for nothing for patients. I want to say one other editorial thing. I've been here now 8 years. I never understood this, why health care is a Republican or Democrat issue. Look, I've never seen a Republican or Democrat heart attack in my life. I've never operated on a Republican or Democrat cancer in my life. I have delivered a lot of Republican babies, I will tell you that, where I live. But seriously, it's something I've never understood, and I did not understand. I've been a doctor 46 years, and when I came here, I thought somebody cared what that experience meant. I was not asked one thing. There were 9 physicians in the Docs Caucus at that time. Not one of us was asked one thing about that health care bill was passed. It's one of the reasons it's a disaster right now.
Just real quick, I'm sorry. The concern is the 7% that is affected, right? 93% of Americans are covered. How do you address that? Is it what people are worried about is the free or the 7%? How do you catch them?
Now, I'm not sure I followed your question. In other words, what do you do with the people?
If 93 or 95% of Americans aren't even affected by Obamacare, didn't even need the Obamacare reform, and say 5 to 7% are the ones that are affected to get your universal coverage, how do you avoid the free fall for those 7%?
Well, that's a very tough question. Right now, you have 155, 160 million people covered by their employer. And one of the ways to make it better is get more employers. That would help. Actually, no more people with an expanding economy have health insurance through their employer than 8 years ago. That's never happened, and I know in our history. When employment's going up, health care coverage goes up. 57 million people get insurance through Medicare, and now 73 million people get insurance or they get a card through Medicaid, which is a failed system. And by the way, I guess Marcia had to leave, but exactly what happened in TennCare reform is happening here. Guess what the Medicaid cost was? 50% more than they thought. 50% more. The exchanges the subsidies this year are up from $32 billion to $42 billion, up $10 billion. So there are a lot of this bill is amendable.
And I would add it's a false pretense that Obamacare has protected and covered everyone.
Yeah.
9% across the country, 11% in North Carolina, my home state, still don't have insurance. So even starting from that pretense or that argument is fallible even to begin with. Let me go to this young lady to your right here.
I'm Jane with CNN. This legislation is supposed to be a repeal and replace plan. Can you just walk us through your approach on the repeal and delay approach, waiting 2 or 3 years for the delay to take place? And is this committee explicitly opposed to any plan that wouldn't simultaneously replace?
I don't know that we're opposed to anything, and there are several options on the table. As Speaker Ryan has said over the last 2 weeks, repeal is relief. When you hear from the amount of small businesses and individuals, I can guarantee you the stories behind me of constituents contacting them, there's something immediate that needs to be, we've got to put out the fire immediately. We haven't put a timeline on the replacement side of that. We also have to make sure that we understand the reconciliation aspect. Many of us worked hard in the 2015 114th Congress to make sure that we were able to, that 51, the simple majority threshold under reconciliation. We want to stay within those bounds to make sure that we're to alleviate this fiscally and horrible financial burden on the American people. So a little bit of your question is based on anticipation. We don't have the full timeline as far as the replacement, but we want to make sure that we can do what we can do immediately, and that is make sure that we're repealing the Affordable Care Act.
And just one other comment for the chairman. I heard it again on the House floor when I was down there right before I managed the bill just a few minutes ago about how Republicans have no ideas. That's absolutely false. We have a plan, a 185-page plan. It will not be the exact, it's amendable. I haven't written the perfect bill. Austin Scott, this group didn't write the perfect bill. I'm willing to listen to Democrat ideas about this, to amendments to this bill, as opposed to what they did, which completely shut the other side out.